do with other dental surgical procedures.
It's no different than anything else.
We put patients on medications to get them better faster. The risks that do exist are relatively infrequent. They're related to maybe delayed healing time, if it's a rare situation like that, or maybe the need to switch a medication to something else.
Talking about healing time, what's the average healing time, and is it painful?
The average healing time, depending upon what we're doing and which jaw we're operating on, can range from anywhere from 2 to 3 weeks to upwards to about a month and a half. Most patients are quite impressed by the fact that after they leave the hospital, it's rare for them to take pain medicine. While they're in the hospital, we of course keep them comfortable. When they go home, we usually give them something very mild to take as an analgesic or pain medicine.
Pain medication.
And most patients often tell us after a few days they don't take that at all. It is something to get used to. People have to get used to eating a soft diet. After
during the healing phase.
During the healing phase. We sometimes have to rest the jaw. We may have to use the braces to put rubber bands on to rest the jaw while the bone heals. So patients have to be on a liquid puree diet for somewhere from a few days to a few weeks, maybe upwards of a month and a half, depending upon the surgery.
That's not such a terrible thing.
Not such a terrible, and people lose weight.
Well, yeah, absolutely. You know, so help me out, you know. I've had patients who have had orthodontics when they were younger. And then they're still, for whatever reason, they had a relapse of the teeth or the jaws grew differently, and things were done years ago differently anyway. Can these patients still have this procedure? Yes.
Sometimes it requires undoing a little bit of the orthodontics that was done when they were younger, if they weren't thinking of surgery when they were young. Sometimes we don't have to do that. We can do some corrections without having to have braces again. It depends on the situation, but in most cases something can be done.
That's good to know. Must you, because I know the procedure, and I've been in the OR and assisted. These things were done years ago. Today, must an individual always have their jaws wired up after the procedure?
No, and that's
years ago always was wired up.
The most significant advance in this area of surgery is the ability to do the surgery and fix the jaw in its new position with a new technology which allows us to fasten it very rigidly in a new place and actually not have to have the jaws resting after the surgery. And in some cases, patients go home after the surgery, and we do recommend they stay on a relatively bland, soft diet, but they don't have to wear rubber bands or wires as they did years ago.
Now, what if a person has a jaw deformity and just doesn't do anything at all? What can happen?
Well, I've heard my colleagues in orthodontics talk about this, and we kind of feel the same way about it. A bad bite can lead to bad dental problems. And if you don't fix a bad bite, as you wouldn't if you don't do orthodontics, the same problems will occur here. You might get early loss of teeth, you might get early onset of gum disease, you might even have developed some functional derangement where you might get some joint problems later on.
You don't want that.
So these are all issues that both orthodontists and surgeons have to address with their patients.
Are the bones weakened by this procedure at all? Some patients would ask that question.
Absolutely. It's a natural question.
Yeah, and they say, well, if you're going to touch my bones, that means that I'm going to have a problem, and is that a myth?
It's a myth. When we do surgery, not just we, any maxillofacial surgeon who does this kind of surgery can tell you, once the bone heals, it's as good as it was before the surgery. It's no less, it's not any weaker, it's not a glass jaw, as many people often think.
That's what people are afraid of.
But after the defined period of healing has taken place, that bone is as strong as it was before.
If you remember again on the clip that we showed at the beginning of the show, we showed John as a child, and then at a certain age, all of a sudden, there was something happening to his jaw. At what age, if a parent notes that there is a deformity happening, when should this be addressed?
Well, I think it's...
And what are the early warning signs?
The early warning signs is, one, the obvious facial appearance will dramatically change. It's never too early to begin to think about what's happening to my child who's developing either a bad bite or a funny facial appearance. And today we're into such new things with our ability to modify growth of the jaw, with even appliances that are being used, which is a new technology. We can affect the growth of the bones of the face very early. So I would say as soon as you notice a child with a developing problem, notify first either your pedodontist, the person who's taking care of their children's dentistry, or your orthodontist, and have them assess the problem and possibly recommend you to a surgeon or somebody who's comfortable with this technology to address the problem early.
How early would you treat somebody? Say you have a child and you notice, like, again, John, and John has this problem, and then we notice it's at 9 years of age, 10 years. What do you do?
John probably would benefit from what we call early orthodontics to make sure the teeth that need to come in will erupt properly, and then probably surgery when his growth has stopped, maybe 15, 16, 17 years of age. So that should be coordinated with the orthodontist. The orthodontist would notify the surgeon what he's intending to do early. They would map out a tentative treatment plan that may be 5, 10 years down the line, but they would plan ahead. It's never too early to plan ahead. I mean, we do this with our government. We're planning for the millennium.
Yeah, Y2K, some planning.
So we have to, you know, 5, 10 years of planning for your child, do they deserve less?
I couldn't agree with you more. Absolutely. Who performs this kind of surgery? Somebody watching this show, they've met you. It's one thing, but not everybody can come into New York City, and they want to stay local. Who will do this kind of surgery? Who do they look for?
Well, they should look for somebody who's a trained oral maxillofacial surgeon who does this kind of surgery in his practice or her practice, is associated with a hospital that the surgery is being done at.
Would you do this in your office?
We don't do it in our office. I've heard of places where people do it, but we don't recommend it. I think you get the best of care in a hospital environment. We have our personnel trained to take care of all the things that you need.
But you said earlier, it's a surgical procedure.
Absolutely.
Any complication, any risk can occur.
Absolutely.
I would rather, if it was me or my child, I would rather be in a controlled environment, which the OR certainly is.
Absolutely.
Now, very quickly, tell us about the Stuart and Tibby Super Dental Facial Center at New York University College of Dentistry. We got about a minute left.
Okay. Well, that's a very special thing that my wife, who is very important in this aspect, helped me create at New York University to help people with various facial deformities, and particularly people who don't have the means to get treatment. So we've established not only a center for bringing together students and professors from the university and other places to study and advance.
But you also have a website?
We have a website.
Do we have the website written down
I believe we put it on the...
Do we have the web? Oh, it's on there. Excellent. Okay, great.
And we also periodically raise funds to help kids who have no means to get this surgery.
Oh, this is great.
So that's what the center's all about.
So the school, the university is always doing a lot of public spiritedness, which we know how good NYU is at doing all this.
Absolutely.
Which is excellent. It's terrific. I think you're providing a magnificent service. This is terrific, and you're really such an expert at it. It's clear from what one can see from the results of your labors with the patients. And the beautiful thing is that when it's done, it's completed, it doesn't look like it was a labor. It looks like it just flows and it just comes across, and you're actually giving a new breath of fresh air to people to be able to live a better life. It's terrific. Stuart Super, you are a super individual.
My pleasure.
Thank you very much for coming down and being on Tooth or Consequences.
Thank you for having me.
It was fabulous, and I'm sure the guests at home, the guests here, and the folks at home really enjoyed seeing everything that you did.
Much.
So it was really wonderful. So again, thank you for watching the show and learning something interesting today. And it's very important that I always tell you this, may the floss be with you, for if not, it will be Tooth or Consequences. So we'll see you next time. And just take care of your teeth, be true to them, or they'll be false to you. Okay, so long for now.